right now. So that's just a good reminder not to share any of your protected health information. If you have anything that you want to use the chat, we're going to be taking those chat questions and putting some of that into the logs. So my name is Nicolette Cordova. I am with the Department of Healthcare Policy and Financing as the Case Management Redesign Community Liaison. So if anybody is joining by phone, just a reminder, you can press *6 to unmute your line or *9 to raise your hand. You can also do the closed captioning, and we will be posting all of these recordings onto our Case Management Redesign website after the meeting. So one of our housekeeping items, again, is that we are recording this meeting. So no matter what does end up getting said, it gets posted to the website. So we just let you know to be cautious of not sharing any of your personal health information or that of any clients or family. Please be cognizant of sharing all of that. And you can provide comments verbally or in the chat. To comment verbally, click the raise hand icon to be put in the speaker's queue. To comment in the chat, please put your question or comment in the chat feature of the Zoom, and make sure to check the listening log to make sure that your comment was captured accurately. If we were not able to answer those in the chat, we're not going to be reading out loud all of the chat items, so you can go ahead and come off of mute if you wanted that answered right away, or raise your hand to come off of mute. We will try to get through all of this so everybody has a chance to have any kind of questions or comments that they need answered. So for today's agenda, we're going to be, we're doing our housekeeping items, and then for our case management rule follow-up, we're going to be addressing some of those issues that we did not get to address from the last meeting. So case management training and tools, quality, and a listening log open discussion. So you'll have a chance, if there's time at the end, for specific listening log things that we have not addressed here. We will take the time to do that. So for our listening log overview, this has been kind of a topic that we've been talking about. So what we've been trying to do is take from the listening log those themes that everybody has still had some issues with. So the case management agency choice was one that we saw throughout the listening log, the cost containment, case management agency training and case management tools, and case management agency accountability and quality. So the log is provided publicly with written responses. And for specific items, we're just asking that you reach out to Tiffany or myself, and I'll put our emails in the chat if you've gone through the logs and there's certain things that we have not discussed here. So the last one we've already kind of opened up and talked about case management choice and cost containment, and how we steered in a different direction with both of those based on some of those issues that we kept seeing in the listening log. And for today, we are going to be then still going over that case management training and case management tools and accountability and quality to try and capture all of that. We just don't have the capacity to be able to go line by line through every single section of those logs. We're up to now over 500. And so to do that, even if we took just a couple of minutes, we wouldn't have that capacity. So what we have been trying to do is just really keep going through, seeing what those main themes are that everybody is still wanting to have us look back into and discuss openly, and then we've taken them here. So again, if there's other things that you feel like we have not been able to address, we are going to try to be completing those logs by mid-July. You can go through and you can kind of do a control F through that listening log, look for your name on there. And if you're seeing that there are a few that you've had a question about and maybe we didn't answer it to your satisfaction, please reach out to us directly. So that is where we are at for the listening log issues and discussion. We are going to be now going into some case management training and tools. And for this, we are going to have Kidron, our subject matter expert, come and talk to you. First, is there any questions regarding that listening log overview piece? Okay.
I think we've got a quiet group this morning so far. Yeah. We're going to have to get everybody warmed up.
Yes, I am. I'm not seeing anything, so I'm going to let you take it from here, Kidron.
Great, Nicolette. Thanks so much. Welcome, everybody. Thanks for joining us. I have the pleasure of tackling some of the listening log concerns that we had. As Nicolette said, last session, we ran out of time. We had some technical difficulties and had really good conversation about our proposed cost containment rule revisions. And so we really want to continue in being able to bring to you things that our case management quality performance team is working on in respect to a lot of the questions that we've received through our rule stakeholder engagement related to how we're going to measure quality and have oversight of quality and prepare case management agencies and case managers to do their job well. And so in that vein, we're going to talk about, if we go to the next slide, I want to begin with giving you an update on some of the tools that our team and HCPF are developing that we feel are going to have a positive impact for case management agencies and for members once case managers and case management agencies have these tools at their fingertips. So I'm hoping that no one on this call today is surprised that we want to start with talking about our new care and case management system. Hopefully you all know that that is coming very soon. We just announced yesterday that we will be launching the new system on July 1st, and case managers will begin using that system on July 5th. We anticipate that once we have all of the planned phases of our care and case management system, that number one, case managers will no longer have to log into multiple different systems to do the separate pieces of work that they do day to day. And just being able to use one system that's going to be able to assist a case manager in level of care assessment, needs assessments, and service planning, person-centered service plannings, and eventually those person-centered budget algorithms. We anticipate that that's going to be a huge positive impact for members and case managers. So we want to share that information with anybody that might not know, but just also share our excitement with the rest of you that we are just that close to making such a huge change in Colorado. A second bullet here talks about not only are we launching the system, but we're using ARPA funding, that American Rescue Plan Act funding, to really supplement the work that we had already planned on doing with the care and case management system. And we're using that ARPA funding to say, you know, how can we make it even better in those future iterations of our care and case management system? What are things that we would have on our wish list to do and to operationalize within that system? The system that we're going to be using is something that is going to be put Colorado ahead of the game from other states in respect to having such an expansive system available to case managers. And so we're really excited about that and excited to have additional ARPA funding to build out the care and case management system even more than we originally intended, and to speed up the trajectory of doing some exciting things with the system. So we want to share that with you all. And then we also have projects that are going on related to also using ARPA funding, but our office is connecting with other offices in HCPF to do things like updating our member handbook. So making sure that we have information that is readily available for members, for community members, for other organizations, to be able to have those resources at their fingertips to help share the word about long-term services and supports and home and community-based waivers. So just simple things like member handbooks, having those updated, having those available in multiple languages, not just English and Spanish, but up to the top 5 languages in Colorado. Also having resources. I think most of the folks on the call today have seen resources with our waiver flowcharts, et cetera. We're using ARPA funding to build out additional resources that we hear community members, advocates, case management agencies, case managers, and families say, we're missing this in Colorado. We need more information at our fingertips. So we're really excited that those tools are in development. We have ARPA projects that are focused on prioritizing our time and the ARPA funding to be able to make that more widely available to folks. So we're really excited to share that. One of the things that we're also very excited to make sure everyone on this call and in the stakeholder group is aware of is our case management learning management system. We're calling it the LMS, so Learning Management System. And I think we've got just a few specific things on the next slide that talk a little bit about why we are so excited about our learning management system that's in development. Our learning management system is going to systematically replace our current training that we have available for case managers. Currently, our long-term services and supports training resources are a combination of webinar recordings, PowerPoint presentations, forms, and resources, all located on one page within our HCPF website, but it's not a comprehensive, here's where all the training is for case managers. And so our learning management system is going to be, I call it state of the art. It's going to bring us into the current day of adult learning systems. We'll be having that available for all case managers to have those learning opportunities. It will empower case management agencies to ensure that their training for their case managers and their staff is the same as anyone else. So we're going to have streamlined training for all case managers versus that more local, each case management agency has, potentially some different training. So we want to make sure everybody's getting the same training and that it's good quality training. Our learning management system will also have better tracking systems for us as a department to be able to really say, yep, everybody's getting the same training, and we've got records to show that case managers did the same training and that they have the completion of training within our regulatory timelines. We're also very excited that the trainings that are being developed are they're being developed with things such as quizzes and knowledge checks within the modules. So it's not just a webinar recording where you hand somebody a link and say, do the training, and then follow up with your supervisor if you have questions. It's that training that they're getting the module, the information, there's knowledge checks, there's quizzes at the end. And so we're really excited to know that that's a better way for us to measure and ensure that case managers are getting that real quality understanding of the material, not just that we provide the information. Let's see, we also have, again, the learning management system is being built to be interactive and engaging to the learner. We have a lot of training materials for case managers to be able to do their job, and we need to make sure that our training is interactive and that it's built in a way that case managers can have that knowledge base when they get finished with the training. We also are excited that through this process and through this development of our learning management system, we have the opportunity to develop modules of training that currently do not exist. We've heard over and over that some of the training that case management agencies or case managers feel is missing are things like we call soft skills, how to have those interviews with members about what their needs are and not be so clinical in how we approach our interviews and the work that case managers do to ask questions and develop person-centered service plans. And so we've got several new modules within our learning management system that's going to help case managers be more prepared for the jobs that they have to do once they get through with all those trainings. So just excited to share that all with you about those two or three things that we have in development. And I think I've got one more slide to talk about specifically how, as a department, we view our capacity to make sure that we are having good quality oversight and measure whether or not case management agencies are doing their job well. But I think this is a good place to stop and ask for questions before I go on to the next slide.
All right, thank you, Kedren. Is there anybody that, if you would like to have any questions answered, please raise your hand, or you can come off of mute and I will put your name in the queue as well. Any questions so far for Kedren about all of that amazing information? All right, we have Betty. Is there anybody else? Okay, well, let's start with Betty.
Will your new training have information about cultural competency with the members that they're serving? That's a very broad, difficult topic, but it sounded to me that they are asking for those soft skills, but they, also need to have a culture of acceptance and not just cost containment. So that seems like we've had an adversarial relationship between members and case managers over cost containment. When a member is saying, I have all these needs, and the case manager is saying, well, we have to really manage the costs. So is there going to be some kind of guidance for them within this new learning management system?
Betty, thanks so much for that question. And I am pleased to say that we have Carly Altman on the call today. She is heading up the work developing the learning management system. So I'll kind of put her on the spot and see if she would like to answer your question specifically to what types of cultural competence and soft skills training will be included in the learning management system.
Sure, thanks, Kedren. Hi, everyone. My name is Carly Altman. I work here at the department in our training and technical assistance unit as a supervisor, and my team is the team that's really working to develop this comprehensive curriculum and create the e-learning modules. And we actually, are working really closely with our case management agencies that have volunteered to be reviewers of the content that we're creating just recently, we had them review the first 4 modules of the curriculum, which include case manager functions and responsibilities, an overview of their roles and responsibilities as a case manager. It introduces case managers to the fundamental roles and responsibilities of their position. And really, by the end of that module, case managers should be able to define their fundamental case management terms, summarize typical functions of a case manager, and that does include the concept of cost containment and utilization review, in that during service planning, case managers are doing utilization review and utilization management. They're doing that with our third-party vendors in some cases as well, and looking at the overall cost of the services that they're being provided based on the member's assessed need. They'll also be able to describe the programs that are offered by the Department of Healthcare Policy and Financing, and summarize characteristics of other Health First Colorado benefits and the Children's Health Plan Plus too, just so they get that really basic comprehensive view of what long-term care Medicaid is, what Medicaid is in general. And then our second module in that series is called Case Manager Skills Training. And this module explains and demonstrates the professional people and communication skills that case managers use most often in their day-to-day work. And they should be able to go through that module and really understand what those skills and concepts and competencies are by the end of the module. We look at things like communication skills, active listening, the way that you're working to communicate with specific populations. The third module in that series is called Cultural and Interpersonal Competency. And it really introduces case managers to relevant cultural and interpersonal concepts and best practices. They should be able to explain what cultural and interpersonal competency concepts are by the end of the module, and recognize unique characteristics in themselves and others that they may require adjustments to administer case management in a responsible, effective way. And then our fourth module in that series is called Working with Target Populations. And that module goes into specific characteristics of folks that have Alzheimer's disease and dementia, persons with disabilities, specific communication strategies for other specific populations of folks with mental health issues, brain injuries, working with the justice involved population as well. And those 4 modules really are the first introductory modules in our curriculum, and will be put out onto the learning management system, hopefully here in the coming months, as soon as they're finished with all of their review and technical aspects of getting the modules up and running. And we did share those modules with case management agencies in a smaller review group of volunteers from agencies to look at the materials, and we did have positive feedback on them and the level of comprehensive information that they have. So I'm really excited for these to come out. And then in addition to the rest of the curriculum that's being developed that goes more in depth into each one of our programs that we offer, the waivers that we offer, and other specific case management skills and tasks that they have to complete. Betty?
And I think that sounds like a wonderful curriculum, and don't take this the wrong way, it still sounds like an us and them curriculum. When people come to case management, they have an expectation, whether it's reasonable or unreasonable, that they're there for help, that somebody's going to help them. And cost containment isn't something that they are personally concerned with. And I understand that we've had an assessment of the needs, but these assessments can't possibly pull in all the needs around family issues, all of the fear-based thinking, especially turning 18 and not knowing this system at all. And so my concern is that up to this point, families report to me that they feel like they're running into a roadblock rather than into help. There is still an us and them kind of culture where I'm here to help you because you're too pathetic to help yourself, or it's very patronizing so even though case management has reviewed this learning management system, I don't know if you've had any members take a look at it to see how it feels to them. If it feels to them that case management is learning that people are coming to them for one reason, and that's to help. Please help me. And so if that isn't part of that learning management system, that there's a way to address that between case management and members so that members aren't more confused or feel like now they're in a new adversarial position. Used to be school, now it's this, so that's my concern, is that, we've been living with a culture of an us versus them feeling and patronizing feeling. And it would be lovely if there was some information that helps case managers learn how to be more empathetic to the situation of the people who are coming to them for help.
Yeah, thank you for that, Betty. This is Amanda Lofgren. I appreciate that. I think, when you hear the combination of, Kidron talking about the learning management system and all of the training that will be included in there, and our ability to assign and track and monitor. And then Carly has done stakeholder work to get feedback and input from a number of community partners and advocacy partners to really help incorporate that into the input. I would just like to acknowledge, though, too, majority of the case managers are amazing out there. And we do have quality issues, but that is how the team is really putting together more of this multi-prong approach so that we can address that as those come up. And so certainly if that is happening, the department would like to know, and we can address that with the agency directly, because that is kind of a performance and quality issue too. And then at the last meeting, for those of you that maybe weren't able to participate, the team also talked about, increasing and improving our quality oversight, transparency, and accountability through a continuous quality improvement approach. And so looking at each of these individually, we definitely need to have that comprehensive plan and approach, which the team has done a great job of putting forward. So I really appreciate that feedback, and I think it really aligns with the work and the goals that the team is striving for. So.
All right, thank you, Amanda and Betty, for your question, and our amazing subject matter experts as well for helping to get those answered. We're going to move forward to the next just so that we don't get behind, and we should still have some time afterwards for discussion if we can keep moving along.
All right, great, Nicolette. So I have one final slide to kind of go over some points that I think will help the stakeholder group in respect to some of the comments that we've received on the learning log related to how does the department expect to have oversight and quality over some of the rules that are proposed. And there's been several comments that have been related to an ask to the department to have very specific information in our rules. We've had a couple of conversations about where we leverage our department rules and what we have in our case management agency contract. And so I just wanted to take an opportunity to just circle back to that approach and how we use our rules and the core purposes of rules versus our contract to just kind of come full circle to some of the things that have been mentioned in our stakeholder feedback through our listening logs. Our department rules are regulations to determine those high-level requirements. We apply across the entirety of the state our rules and across all of the waivers. So again, as we bring in that new case management section, that's our goal, to create the case management section, to apply that streamlined approach for all waivers and keep that high level. It also helps us make sure that we're meeting federal guidance, statutory requirements, those basic things like what are member rights, basic case management agency core functions, requirements that are non-negotiable, right? Those are the things that we want in our rules. Where we want to make sure that we're using our contracts and leveraging our contracts with case management agencies is what does that look like day to day? What are the case management agency operations? And this is the who, the what, the when, the where, and the how of how we meet those rule requirements. We want to make sure that our contracts describe how the department oversees the work that case management agencies do, how we monitor case management agencies, and how we hold case management agencies accountable. And our contracts are what we call our teeth, right? That's how we make sure that we are day-to-day providing the case management that needs to happen. And, you know, one thing that we want to make sure that everybody understands is, while there may be a desire to have more of the who, what, when, where, and how and rule requirements, if we were to add those things in rule, we lose flexibility to make sure that we are able to make changes that need to be made. We can do that year to year or with contract amendments. If we find that something's not working based on how we have our contracts written, and we're not getting, you know, the performance we want or expectations met that we want, we have the flexibility in a contract to make an amendment or to be able to make sure that we're responding quickly to address those concerns. If we have those who, what, when, where, and how in our rules, we lose that flexibility because the time to change our rules is much more lengthy, as we all know through this process. So we just want to make sure that everybody in the stakeholder group knows that we hear you and wanting the teeth and the who, what, when, where, and how we apply these rules and things that you bring to our team. And we plan on using our contracts to have that detail and being able to empower the department in our quality and oversight. And with that, I believe that sets up the next slide for case management quality.
Yeah, hi everybody. I'll be taking over here the quality section. So I am Brent Sellner. I am the continuous quality improvement supervisor here at the department. And so we just wanted to give you kind of an update on where our current state is, because we've had, questions on how we're going to have better oversight over quality metrics for case management agencies. So we'll kind of dive current state, and then we'll look at kind of what our future thought is on what this will look like. So go next slide, please. So here's our quality oversight currently. So we do the quality improvement strategies. And what this is kind of an annual review of case management agencies across all the waivers. It's for the entire state of Colorado. So it is not looking at, it's not a statistically valid sample for each agency, but it is for the waiver and sort of the overview of the state, which we report to our federal partners. In that we provide those results to those agencies and then do remediation work around metrics that we are not hitting as a state for quality. So we do that work currently. We also do the national core indicators, which are the member satisfaction surveys, which go out to all the members and compile that data to get feedback on areas that maybe the state is missing or members are not having great satisfaction with, that we can address through training needs and oversight. And then we do our programmatic reviews, and these are targeted reviews of each case management agency. And what those look at is a statistically valid sample of each agency, and the content is going to be kind of driven around complaints we've had or metrics that we feel like we've underperformed at by state reporting to our federal partners as well. So that one we do get to dive in with each agency and do a more thorough report looking at policy and procedures, personnel, and then diving into metrics that the state has seen as the core indicators that we need to look at. And then finally, we have the financial reviews. And those are just the reviews of the case management activities and making sure the associated payments are being accurately given to case management agencies. So they're not missing payments. The work that is getting billed for is adequate and complete. And, a little background around sort of these metrics, with the programmatic reviews, this team started off as 2 members trying to look at each agency in depth. And we found that, there was a need for a more timely approach to this strategy. Those agencies, we'd get to about 4 or 5 in a year. And so we were always working sort of in hindsight, right? You deal with an agency, you address things, but then you may not address things with those agencies again for a couple of years. And with all this change in state of, new systems, new rules, new regulations, we found that we were always falling behind and playing catch up. So that kind of brings us to our next slide, which is the future state of what the quality oversight will look like. And so this future state will be kind of an oversight of case management activities on a statistically valid sample size. And this will happen yearly. So we'll be going in current time. So while we'll still do the QIS metrics and pull that information, which we'll report to our federal partners, we will also be taking a statistically valid sample of each agency at that time and doing that review in real time so we can report on a yearly basis. Our thought process behind that is that if we're able to address it in real time with the agencies, we're going to get better results and be able to continually work with them to reach the results that we're looking for. We will still use the National Core Indicator Member Satisfaction Survey data along with that. And then our goal, is to, develop scorecards based on case management agency metrics that we will publish for everybody to be able to see. So public record. So those metrics, I know there may be questions on that, have not been fleshed out yet. We have done some stakeholder work with the agencies, to have a discussion formally about that. And gotten feedback on thoughts, concerns, fears around that, because I know it can cause a lot of fear for agencies as well. So we're still fleshing that out, with the new system based on metrics that we're going to find that we feel incorporate and, encompass what we find to be the most beneficial, and also that stay fair to agencies is something that can be reported accurately. And then the financial reviews, those will continue as current state. So those reviews will kind of take place in the same function that they have currently. And so I think with that, I will stop for a second and see if there are any questions before we would move on to our next slide.
Thank you, Brent. Okay, so we have Betty in the queue. Is there anybody else that needs to? You can also take yourself off mute just to give me your name and I can put you in the queue, or *6 if you are on the phone. Okay, not seeing anybody, we will go to Betty.
I'm curious if the metrics are going to include, and maybe they already do, an examination of a person's SPAL or CIS level versus their utilization of the opportunity, and whether, if there's an underutilization of the opportunity of the budget, if that's due to what the waiver offers as support as not being the supports that are needed, or what would cause that? Because right now, or back in 2021, the average utilization for SLS was about $17,000, and a level 1 was over $18,000. So the average usage of the waiver benefit didn't come close to the actual budget for the waiver. So there must be a reason why people aren't fully utilizing the benefits that they're eligible to receive.
That's a great question, Betty. So when we look at, we do utilization monitoring. I think that is part of what we look at every year for each agency and for members to kind of see if we're having utilization issues and be able to dive into those. So I think, that is part of what we are starting to look at with the SIS level reviews as well. I think we do need to take a deeper dive into that to, kind of rectify what you're saying you see with those numbers and kind of get to the root cause of what that is. So hopefully with this continual oversight of that, we'll be able to dive in on a better basis. I think Kidron wants to add in here.
Yeah, thanks, Brent. And I would just also add that, when Brent's talking about this quality and oversight, there's specific measures that we have to have data to review. But keep in mind, there's still the requirements for monitoring for case managers, having the responsibility to check in with members. And when we say monitor, it's really looking at a comprehensive review of a member's service plan, including utilization. So the expectation of a case manager during the quarterly monitoring, is that they look at the picture of the member, their service plan, and look at utilization and ask those questions. So your question, Betty, may not quite exactly fit into what Brent's talking about of how the department oversight plays into how we measure, those quality performance measures. But case managers we're training case managers. We have the expectation of case managers to do that utilization review with members and to make sure that their service plan is meeting their needs. And if not, have a discussion about what needs to happen next, whether it be different services or, whatever the case may be. So just wanted to point that out, that it may not be within what Brent's talking about, but we do have that expectations for case managers.
Betty?
And so to follow up, when at a state level, we look at utilization review, and if, for example, a legislator or somebody high up in HCPF says, well, we've offered them X amount of money and they're only using a 16th of that, what is what's going on? And if HCPF, if at your level, at the state level, they say, well, we don't know. We had an expectation that each case manager would help their clients maximize their opportunities, but apparently that's just not happening on an overall basis. And so I think it's a shocking number when you see the actual utilization and that funds are being refunded back to the state. And I don't know, that awareness should only fall on case managers on an individualized basis and not be a concern for the overall state and quality of the opportunities that people have. Are they not accessing them? Do they not know about them? What's going on between what's offered and what's used? And I think that is fairly profound. And it's great to have that expectation, but you might get pockets of excellence and not know what's happening across the board.
And Brent, I think, correct me if I'm wrong, part of your performance quality reviews and QIS reviews is meeting with each one of the case management agencies. And so if you see that as a performance measure, that there are members that have very low utilization, that would be a point of discussion with your team and the case management agency to try to dig in a little bit more and get more information about that. Is that
Yeah,
correct?
That's correct, Kidron. Yeah, so when we meet with them, we give them a sample of members that we found utilization to not be adequate, and we ask that they dive into those numbers and work with their staff to kind of identify the root cause of why that is taking place in that area. So we do look at that. I know, there's a lot that goes into these type of reviews and the feedback, and each area kind of has different concern points, right? With why utilization may be low, due to lack of providers, members maybe not wanting to receive services in home, those kind of things. So we do dive into that just to find a root cause and try to work with that as a greater good with the department to see how we can identify and hopefully improve, that ability of those providers. So, but yeah, thank you, Betty. I mean, I think that those are great questions that we need to, look at a little closer, but I do appreciate that feedback.
Thank you. All right. We can move on to our last area, and it was just our cost containment follow-up. Did you have something for this one, Kidron?
I don't have anything other than we wanted to make sure we had space for folks to ask questions. Our last stakeholder engagement, we showed you all the proposed rule changes, which, someday we're not going to say cost containment or over cost containment. We're going to get rid of that language because it's outdated and, really move towards having rules that match our practice of having a needs-based assessment for members to help develop their service plans and having a path to have approval for folks that may have service plans that are over a daily PAR limit, having a process and a path to get those approved. But just wanted to have space for everybody today after they've had more time to look at those rules, proposed rules, and see if anybody has any questions.
Okay, so if anybody does have questions or any follow-up, you were able to go through and look at all of those that we presented, and Kidron read for our last meeting out loud for everybody. Go ahead and bring that here. You can raise your hand or you can come off of mute and put your name in. All right. And that one was also on May 9th. So in case that was the only one that unfortunately we weren't able to record because of some of those technical difficulties. So we do apologize about that. But it was a good discussion, and my recollection, a lot of people were appreciative of those language changes. So if there's no other questions about that, that is our conclusion. So what we have some time and space here for is if anybody has had any of those questions right now through the listening logs that you feel like there's been other themes that maybe we missed, maybe we didn't catch, questions about anything specific to those logs, now is your time that you can ask questions based on our case management rules that we've already gone over with everybody, and listening log items that maybe we've answered and you didn't feel it was quite, you didn't understand it, or we didn't explain it well, we need to address today. Does anybody have anything for that? You can also raise your hand. We have Betty. Anybody else? You can also do the *6 and give me your name, and I'll put you in the queue, or you can come off of mute and give me your name and I will put it in the queue. My goodness, this is a quiet group. Betty, go ahead.
Okay, thank you. A large concern that I have still, and I just want to put it out there one more time, is the expectation that members have that the term case manager means that that case manager is representing their best, the members' best interests. And indeed, that may be true some of the time. But the case manager is really an agent of the state and has to represent the state's best interests as well, and actually primarily. And I think that it's very difficult for a case manager to walk that fine line between trying to help somebody, but also being an agent of cost containment or whatever, you know, factor there is on the state side that makes it so they're not truly an agent for the person. And it's very confusing for members. And I think it might also be very confusing for case managers. It's a tough road to hoe, you know, to be the front person to somebody who desperately needs help, who wants you to help them, and thinks that you're there for them, but then the case manager has an obligation to the state. And a point that Deanne brought up was, you know, that when a case manager doesn't get a response from an RFP, then what happens, you know, because the member is like, well, they didn't respond. Do you know anybody else? And the case manager says, no, I don't really. Then what happens? So people may not be utilizing the benefits that they have because we have the direct, you know, the shortage of direct service providers or whatever, but it just leaves both the case manager and the member in a terrible position with each other with hard feelings because the help isn't there. And it's not necessarily the case manager's fault, but they are the ones facing the member with this information. Just seems like we have an unspoken problem about that.
Thanks, Betty. I'm going to jump in really quickly because I think that you know, your comments are coming from your experience working in the advocacy world that you do, and it's really important that we have that perspective. I would just like to say that I'm going to speak for our case management quality performance team and our work in case management redesign and all of the efforts. You know, when we talk about all of the priorities that we have as we revise and revamp and move forward in our case management world with case management redesign and all of the things that come with it, at the core center of the efforts that we are making and prioritizing is making sure we have a person-centered approach to case management across Colorado. And I bring that up because person-centered practices are at the core of making sure that case managers are trained to assess the needs of members on an individual basis and identify and match services, supports, and paid supports and environments for people to help them be the most successful in their home and community. We use, you know, all the efforts, the training, the new system, the new assessments, like all of the work that we're doing is at the core of it, trying to be person-centered and empowering case managers to have those skills. So it is not a matter of case manager versus member, but rather giving the case managers the tools to be able to complete the work that they need to do with their roles and responsibilities and create service plans that are meaningful and purposeful and get members the right services at the right time. It's not perfect yet, and we have work to be done. But to Amanda's point earlier, we have amazing case managers across the state. Our efforts currently are where do we have room to grow and develop training and new systems to make sure that we have more well-versed case managers to be able to do that. So my hope is, although you have that concern now, and that's been the historical past, our team hopes that when you look at our proposed rule changes and all the efforts for case management redesign and the things that we bring to you, that you understand that the core priority is person-centered service planning and case management. And that's our goal, to get to that space.
Thank you, Kidron, for answering that question. Is there any other questions regarding the rules that we've gone over with case management through the last months that are in the listening log that maybe you've seen that we've answered, but you still have you still have some concerns that we haven't addressed here today with some of those themed areas? Maybe we're missing a theme. It sounded like before that there may be specific listening log issues that you wanted to address. So we are trying to give some of that time here. Betty, go ahead.
So have you, there is a lot of turnover. And I really love my case management agency and I love my case managers. I'm not having problems personally. A lot of what I report on is because I serve families all over the state. And so I get to see the experience through their eyes. What I'm wondering is, when one of the things historically that they've reported is my case manager du jour. Like they said, I've had 6 case managers this year. There is turnover. And I'm wondering if the point that I brought up before, where they feel conflicted between their desire to help people and their bureaucratic restraints, which are there by necessity. But if that conflict for them is part of the reason that they feel that they want to help people and they feel like they can't, either because there's not enough direct service providers, they're just too overwhelmed. What is the reason that HCPUF is seen for the turnover that we've historically had so far?
I feel like that kind of also spoke to what Kidron was just talking about, that these may have been some things that we've been seeing in the past, and these are all of the ways that we're trying to show that we're going to move into the future of case management in Colorado through case management redesign, through all of these new trainings and cultural competencies, and reducing our large number of case management agencies so that it is more manageable, so that there's more oversight from the state, so that we can really dive into some of those specific issues in more detail. I don't believe that we're ever going to make it perfect, but I think that we are going to try our best. And that is one of the reasons that case management redesign and all the work that everybody has been doing behind the scenes is important to me. I think that case managers, that advocates, that people of the state, we all have that common longing to have this robust, very good case management system where we can go to our case managers and get the full amount of support and have our needs met. And I don't believe that any case manager comes into this thinking that they are just going to be there to worry about, bureaucracy in their day. I think most people have the spirit of wanting to help other people. And we are going to do our best to continue along these paths and all of these things that we've kind of just explained through the quality oversight and training to help them as best we can along the way so that they can help all of our members.
Yeah, thanks for that, Nicolette. And this is Amanda Lofgren. I would just also add, not to lose sight of what Kidron very first presented on with the new care and case management system. Our case managers currently have to deal with 3 different IT systems and navigate that. And a lot of the clunkiness that we have in our system will be addressed with, I think, significant administrative improvements and reducing some of the burdens that they have to navigate there. I mean, one of our key overarching goals for case management redesign is consistency across the state. So wherever you live, you should have similar experiences with your case managers. And I think that's where, being able to identify through our performance and quality, if there is a case manager that's struggling or needs additional training, those can be assigned to them. We are also incorporating caseloads. So going forward, there will be a standard caseload set. And I think there was a question in the chat that asked, how will we monitor and measure that? And so as part of the work that Brent and his team will be doing on an annual basis with those continuous quality improvement plans, we'll be able to see timeliness around, monitoring and assessments, as well as intakes and screenings, and be able to look to see at an agency level if they're hitting those timelines and meeting those needs, in addition to some of the satisfaction surveys, and the NCI data. And so pulling all of that together. But I would also just, want to offer, because there's been a few comments made, is that we are in a state where there is finite resources. And so we do have to work together, all of us. It's not just a case manager. It's not just the department. It's also part of members and families' responsibility to all work together so that we are really truly ensuring that people's needs are being met. But that we're also meeting everyone's needs across the state. And so that is a tricky balance, and one that I don't think anyone across the country has been able to really dial in. But I would also encourage you, this is the space. If you have specific recommendations, I know Nicolette and Tiffany would love to receive your email with some, specific ideas or thoughts around that. So certainly would open that opportunity for you to share that in writing with us so that we can make sure to log that and take that into consideration for future work. The other piece is, and I think I really appreciate, Kidron, I think you also offered that insight of, case management redesign. We've been working really hard. This isn't going to solve 100% of the challenges we have today, but it gives us the foundation to continuously work towards improving and monitoring with the additional tools and resources we're putting in place. And so I think that I would open it up to you all to make sure that like, this isn't the last time we're going to do rule revisions or have program changes and improvement. This truly is that foundation for us to pivot from where we are today to future state, and then continue to work together collectively to adjust as needed.
Thank you, Amanda. We have Shauna in the queue.
Hey, good morning.
For a question. Go ahead, Shauna.
Can you hear me?
I can.
I was just wondering, I did check the listening log a couple of days ago, not this morning. And some of the ones that are still under review, I was just considering the ones that were like medication management, and under that, where we've actually removed some of the authorizations, like other than provided by a relative, other than provided by a relative, and then like the G-tube feeding, and I'm going off the top of my head, was quarterly visits and monitorings and certifications until deemed competent, and that one kind of went away too. And so I'm just asking if you guys deem that those no longer should be in place. Is that just the end of it, or does family have input on those types of things where something has been completely changed or removed from current rule and it's a new rule?
And you said that those issues were in the listening log, correct?
They are still under review. And that's why I'm just wondering because I asked her, is there going to be one final meeting before everything goes through to address anything that has been changed that's kind of drastic, like, the G-tube feeding. You have a family caregiver, a relative who's been doing it for 18 years before they go on to the DD waiver. And now we're having to have a nurse, an RN, or somebody go out to observe and deem them every quarter competent. Seems over and above when previous regulation let you do it till deemed competent.
I see. Okay. So this was from this week's, right? Was that this week's?
I can't remember when we went over all of those.
Just been May 30th. So
around either that or the one before that. I can't quite remember.
Yeah.
And then there's the one that got removed that says it's all on the under the Q mapping. And in current statute, it says that the QMAP qualifications and documentations must be met unless medications are delivered by a relative. And so that one went away completely too, which means there's going to be a heck of a scramble for people who are relatives who are the family caregiver to now go get QMAP'd and to get all of that information and get back updated. Like, again, it just went away. Like, I don't know if someone missed it, or are we actually changing the rules so that no longer applies?
We can definitely take that one back to our benefits team. Sorry, this one we don't have the answers just because we have our case management from our past case management agency rules that we went over.
Right.
But that is something that I'll make sure that we take back to the benefits team. And we do plan on having one big wrap-up meeting after everything. So this one, we're more just kind of wrapping up any unanswered questions still from those case management agency and case management requirement rules. And then now we're moving on to provider and benefits and services. So
okay.
Then
I apologize.
No worries at all. It's good to keep that on our radar so that we can still bring that back and have more discussions around that for sure.
Thank you. You guys are doing an amazing job.
Thank you for that. Let me make sure I haven't missed anybody that wants in the queue. Are there any other questions? Anybody that wants to raise their hand or come off of mute and let me know their name or put their name in for the queue regarding the follow-up to case management.
So, and Nicolette, this is Steve Lutsky. One of the things that we're also doing is we have a crosswalk that's got all of the language in the current rules in it. And then as the new rules are being created, we're adding that to the crosswalk just for the purpose to make sure that there wasn't anything left out, so that we'll be able to crosswalk the comparison. And, you know, it is possible that in this major change in the reorganization that some things got inadvertently dropped. So we have that check in place to try to prevent that.
Thank you for that. We don't have the crosswalk complete yet, but it will be once the rule revision is complete. Thank you. And Deanne.
Hi, I had put a question in the chat, and I don't know if this was the appropriate place to put it, but I know that you had mentioned that there was going to be like a scorecard for the various case management agencies, which I'm thrilled to hear about. I did have a question as to where would those be published or made public?
We have any of our subject matter experts for quality that knows that?
Yeah, so sorry, Dan, that's a great question. I don't think we've gotten that far in the process. I mean, they will probably be on the department site, but we haven't figured out the exact location yet. Still a work in progress, but we will definitely let everyone know where that was be.
Okay. I guess my concern is that the HCPF site is really difficult to navigate. Like when I try to help parents look at citations of various PASAs on the CDPHE website, boy, is it tough. I mean, I have to go through it with them. It's just really clunky. So if we can make it easier for parents and for individuals to see that, that would be great. And then I did have a question in the chat about the 1 to 65 case ratio. And I know that there was an analysis and that this is like the baseline for, or a starting point for how many cases per case manager, how much data or what sort of data are you going to be looking at to determine if 65 is just too high for certain waivers or for certain people getting services? I do believe it's too high, but I understand you have to have a baseline to determine, you know, certain waivers, maybe you can have a higher ratio, but other waivers having a lower one is necessary. Just wondering, what are you looking for to make that decision?
Yeah, I think that will be, you know, something that we continue to get feedback on from agencies. I mean, I don't think right now, you know, all of it will kind of play in, you know, whether it's monitoring, referrals, you know, all of those, the timelines that we watch and the timeliness. But I think some of it's just going to be, you know, working with the agencies as we institute that caseload size restriction and really getting feedback from them and case managers on how that is working and where we're seeing the problems with it. So, I mean, I think it's just going to be done through stakeholder groups and feedback when we do our remediation with them to get feedback from them.
Yeah.
Okay. And would that be like a hard set number? Because I guess my biggest concern is, you know, I work with some wonderful resource coordinators who I think are trying to do their best, but when someone leaves, then those caseloads are adjusted and sized up. And my biggest fear is with this change in case management agencies. You know, I was looking at Rocky Mountain Human Services having a possible 12,000 plus members, and I just worry about people getting lost in the system. So I just don't know how that number of 65 is going to be maintained. I don't know. That's just my fear. And I know I hear that from parents all the time, that they don't have contact with their case manager. They don't even know that their daughter or son is in services. They don't have communication. And I think case managers are just really scrambling. And that's just what I'm seeing, you know, as I work with families.
So Deanne, I'm going to take the rest of the question and just add to Brent's response. So thank you for, you know, sharing those concerns. You know, one thing that we can share is that as we have case management redesign and new contracts being launched with case management agencies, part of their startup plan will be how they plan to operationalize caseload sizes and take care of things like when they have staff turnover, or how they're going to have cases temporarily assigned in lieu of absence, et cetera. So that will be part of the requirements for case management agencies that are onboarding or transitioning. Also, just want to you know, point out that the 1:65 ratio was the result of a pretty large case study, and really looking at the most applicable way to ensure that we have a caseload size for any waiver, as we have case management agencies doing the case management work for all waivers versus, you know, we used to have case management for the IDD waivers and then the non-IDD waivers. And there was a pretty large disparity in the difference of caseload sizes. And so this brings us to a statewide caseload size and our first efforts to really give it a go. And part of that is we're subject to budgetary requirements. We have to make sure that we can operationalize case management with the budget that we're given. And so any change to caseload sizes is going to have to consider what budget we have as a state to operationalize that. So if we talk about, you know, 85,000 members receiving case management in Colorado, going from caseload size of 1 to 65 to something smaller, we're going to have to figure out how to have the money to do that. So those are things, it's not an easy, yep, we need to move from 1 to 65 to 1 to 55. There can be a lot of considerations from that. But just wanted to point out those couple of things.
Yeah, very good point. And I'm actually very happy to hear that other waivers will have a smaller number, because the EBD waiver, I feel tremendous empathy for those case managers. That's a tough caseload.
Yeah, the 1 to 65 is going to be statewide, so it's a starting place.
Right, I appreciate that. Thank you.
Yep.
Thank you for that and all the feedback. We're getting about time for our wrap up. Is there anybody else who has a final question? There's a line, any of the specific lines in the logs that you feel we didn't address fully, or that you may still have questions about? And then even as we're discussing all of these, even discussing the log lines and anything new that's come up, we are still recording all of that into the log as well, so that it is always there for you to see and review. And again, I invite you and remind you that, as Amanda said, if there's anything that you've had some issues for further discussion that have been kind of ongoing, but that you have any suggestions for us, ways that we can help improve some of those areas, please feel free to reach out to myself or Tiffany Domicos. I dropped our emails in the chat. Please feel free to go through and just kind of identify the line in the log that you feel that we may need to address further, or if you have any specific questions about, we would be happy to do that and get back with you. All right.
Nicolette, this is Amanda. Liz Bahar, I see you have a question in there about monitoring, and I will just offer to you that we are having some really fun, joyful conversations with our federal partners and trying to get agreement and alignment around our path forward and the number of monitoring. And as soon as we have that, we will put out information and guidance. We just are not yet quite there and hope to be in the coming weeks.
Well, thank you. I missed that one. Right. We really thank you all for your participation and all of the help, everything that you've been doing with all of the rules and letting us know any areas that we can go in and improve. And we've really enjoyed partnering with all of you. Thank you for coming today. And I'll also leave some time in case you want to copy the chat. And don't forget that pretty much everything is always in that listening log as well. So you can go there anytime. Thank you all, really. We appreciate you. Have a great day. Okay, I think we're all good. I'm going to sign off now. Thank you, everybody. Thank you for all of our subject matter experts as well. Bye.